What makes the both knee powerful and vulnerable? Let's explore the essential structures of the knee joint and understand how common injuries like anterior collateral ligament tears, meniscal tears and the unhappy triad affect them. Myself, I am Dr. Anand, 4th year medical student. So today we are going to discuss about knee injuries. So now we are in episode 14, first aid series, right? So before going to knee injuries, we have to understand the basic anatomy of the knee joint. The knee joint, if you are seeing this image, the knee joint is stabilized by ligaments, cushioned by cartilage and supported by tendons and menisci. Let's break this down. First of all, I am going to discuss about articular cartilage. So this is the articular cartilage. In this articular cartilage, it will be smooth surface on the ends of bones. Okay, if you are seeing here, this is very smooth, this cartilage we call articular cartilage, and its surface mostly we can see on the ends of the bone. So where you can see this articular cartilage means every joint, every bone and part, but here femur, tibia and patella. What's the main function means it allow to pain free movements. What it will do? It allows pain free movement. Okay, so this is the articular cartilage. Then after you can see here one medial meniscus and lateral meniscus. So first we have to understand what is meniscus. What is the function of meniscus means? It's like crescent shaped fibrocartilage pads. Fibrocartilage pads. Its main function is that it absorbs shock and stabilize. So this meniscus main function is it's like it will absorb the shock and it will give stabilize and it will stabilize the knee. Okay, so actually this meniscus is act like cushion. Okay, how in mattress, how we can use that smooth cushion, same to same in knee joint, because of too much weight or if while walking and while standing, while running, it will help for shock absorb and it will stabilize the joint. So that's why this meniscus is very important. Okay, so next we are going to see anterior cruciate ligament and posterior cruciate ligament. This anterior cruciate ligament, you can see we can see these ligaments in like cruciate. Why it's mentioned? Because it's inside the joint. Okay, this is the joint. Inside the joint we can see anterior cruciate ligament and posterior cruciate ligament. The anterior cruciate ligament will be like, we can see like lateral femoral condyle to anterior tibia, and it prevents anterior tibial shift. Okay, next one, posterior cruciate ligament. This posterior cruciate ligament we can see in medial. Okay, here from medial femoral condyle to posterior tibial, because it will go to posterior tibia and it prevents posterior tibial shift. Okay, next one we are going to see the lateral collateral ligament and medial collateral ligament. This lateral collateral ligament and medial collateral ligament, its main function is its side stabilizers. Okay, this medial collateral ligament, it means its mostly main function is it resists valgus stress. That thing also inward stress. Okay, next this lateral collateral ligament will be lateral cruciate collateral ligament. Main function is it's same to same like medial collateral ligament. It resists varus. Varus means outward. if you know about genu valgum and genu varum, you can understand this thing very easily. Okay, so this is the main function of the medial collateral ligament and lateral collateral ligament. Okay, you can see here transverse ligament of knee. This transverse ligament of knee, if you can see image here, this ligament also known as ligamentum transversum genus, main function is it connects both meniscus anteriorly. Okay, this is the main function. So this transverse ligamentum of knee, what it will do means it will connect the both like meniscus anteriorly. Okay, next one we can see here popliteal tendon. Okay, this popliteal tendon is main function is it's like it unlocks the knee. It unlocks the knee when person beginning to flexion. Okay, so in this knee, first we can say like knee before knowing knee injuries, we have to know the knee anatomy. So I already mentioned about anterior articular cartilage and lateral and the medial menisci, and the anterior cruciate ligament and posterior cruciate ligament, medial cruciate ligament and lateral cruciate ligament, and the popliteal tendon importance and transverse ligament, everything we discussed. Now we are going to first aid guide. So guys, now we are going to see the anterior cruciate ligament tear. Before anterior cruciate ligament tear, it's like lateral femoral condyle to anterior tibia and resists the anterior movements of the tibial bone. Okay, first one, anterior cruciate ligament is most commonly torn ligaments in the knee. Okay, this is the most common torn ligament in the knee, and mostly we can see in posterior more common than posterior injury. Okay, mostly we can see like athletes doing cutting, okay, and pivoting or jumping sports, okay, like soccer, basketball, tennis, this type of people mostly you can see this type of anterior cruciate ligament. Okay, next one, mechanism of injury. How that mechanism will happens means sudden change in direction or hyperextension or landing awkwardly. Okay, these are the things. If any child or any adult doing means that patient will get this type of problems. Next one, in clinical signs we can see like audible sound like popping sound. Okay, and sometimes you can see like rapid onset of swelling, that is swelling also known rapid swelling also known as hem arthrosis. Okay, and we can see, and if some instability feeling, like patient will feel like that knee is unstable. Okay, so these are the things we can see. Patients with an anterior collateral tear will show laxity at the knee with the tibia and able to pull forward relatives to the femur. Okay, so we can see in the anterior cruciate ligament patient we can see laxity at the knee. Okay, so we can do we have some maneuvers like special test to find out the anterior cruciate ligament injury. Like first one, Ligament test. In Ligament, this Ligament test will be like most sensitive, and in most sensitive, in this test what we are going to do, we have to flex the knee to 20 degrees. Okay, then after we have to stabilize the femur and pull, and we have to pull to tibia forward. Okay, excessive movement is there means then we have to suspect anterior collateral anterior cruciate ligament tear. Okay, next one, anterior dryer test. In anterior dryer test, it's like we have to flex the knee to 90 degrees and we have to pull tibia like a dryer. Then if that patient getting forward motion, then the test will be positive. Okay, and I'm going to tell one simple mnemonic for anterior collateral ligament anterior cruciate ligament tear. Like in Ligament test means light flexion we have to do, that is also 20 degrees. In dry test we have to do deep flexion, it will comes in like 90 degrees. Okay, so this is the main thing. You can see here image, this is anterior cruciate ligament tear. Okay, this is the main things. So here this is the anterior dry test. You can see this image here. You can, this patient is in supine position and is bending his right knee. Okay, so here in the anterior dry test, the flexion, the knee flexed to 90 degrees, and we have to pull tibia like a dryer, like this direction. It's showing some arrow, right? Like that you have to pull. Whenever you are pulling, that time if that knee is coming forward, then we have to think that is test is positive. Next one, Ligament test. In Ligament test we have this is very most sensitive, and the patient must be in supine position, and we have to flex the knee to 20 degrees, and we have to stabilize the femur, and we have to pull tibia forward, and excessive movement is there means then we have to suspect anterior collateral tear. Okay, next one, next we can see here medial collateral ligament, medial cruciate ligament injury. In medial cruciate ligament injury we can see it is like common in knee injuries caused by severe valgus stress. If any patient getting like inward valgus stress means like resist valgus inward stress, that time mostly we can see like the blow to lateral knee or twisting injuries. In examination findings we can see ecchymosis and joint line tenderness at the medial knee, and in acute like effusion and knee swellings, like rapid onset of knee swellings, and like concurrent injury to the anterior cruciate ligament. And mostly we can see like some laxity will be like appreciable, and when the leg forced into abduction, that time we have to suspect valgus stress test is helpful for diagnosis. Okay, so this is the medial collateral ligament injury. If any tear happen in medial collateral ligament, then the direction of impact will be from that impact will be from medial. Okay, if the patient getting medial stress, that time we can see the problem of valgus. Valgus means this type of condition, that knee will comes very close, like medially very close, and it will touch. So then we have to suspect medial collateral ligament injury. Okay, next, here you can see valgus test. How we can do valgus test means that examiner have to apply inward pressure at lateral thigh with one hand, then examiner we have to apply the outward pressure from medial ankle with other hand. See the directions. One direction will be like we have to apply some pressure inwardly and outwardly also. So this maneuver we have to do twice, like knee flexion will be in knee flexion 0 degrees and knee flexed will be 30 degrees. Okay, next one. Next we are going to discuss about meniscal tear. The meniscal tear will be like the medial meniscus is more commonly injured. Okay, why this thing most commonly injured than the lateral one means this medial meniscus is twisting force with the foot flexed in young patients are due to degeneration of meniscal cartilage in older patients. Okay, so this most commonly injured than the lateral, and mechanism of injury, twisting injuries with foot planted like young patients. In sometimes you can see in degeneration in older adults. So in clinical features, the patient will come with a popping sound and the pain, especially with movements and like catching or locking, and delayed effusion as meniscus is poorly vascularized. Okay, so in test, what are the tests we can do? We can do like in examination we can check for tenderness and joint line and on the affected side, and patients may also have like palpable locking, catching when the joint rotated, extended and under load. Okay, so in test, joint line tenderness, and we can do Thessaly test. In Thessaly test, Okay, I will just explain because I don't have, yeah, we have image. Now we are going to see the Tesselli test. In Tesselli test, the patient have to stand unaffected leg, same to same like this. You can see this image. Okay, this patient stand unaffected leg. Then we have the patient have to flex knee into 20 degrees. Okay, then twist pain catching. If patient getting twist pain and catching, then we have to suspect meniscal tear. Okay, the next one, McMurray test. Here you can see this image. This is McMurray test. In this McMurray test, we can see like the knee, we have the flexion knee. The patient is the patient will be in supine position, and that knee will be the knee must be flexed, and we have to rotate the tibia while extending, click and pop meniscal tear. If patient have meniscal tear, that time when we are rotating the tibia, we can see like a click or pop sound. Okay, so you can see this image. So this is the torn. Okay, this is the torn meniscus being caught between the femur and tibia. Next one, we are going to discuss about unhappy triad. This is unhappy triad is very important. Why? Because this is very most commonly high yield topic to ask questions in your exam. So let's put it all together with a classic high yield trauma like unhappy triad. We can see seen in a contact sports and when a lateral force hits a planted leg. Okay, in anterior cruciate ligament and medial cruciate ligament, what structures are injured means in anterior collateral ligament we can see due to rotational force, medial collateral ligament due to valgus force, and medial meniscus tethered to the medial collateral ligament gets torn with it. So in unhappy triad, these three ligaments will get problems like ACL, MCL and medial meniscus. So what are the presentation we can see in this unhappy triad patient means? First one, acute pain and instability and some like swelling, and we can in special test like we can check, we can see like positive Latchman test, valgus test and McMurray test. Okay, so these are the things we can see in we covered already in we covered the anterior cruciate ligament and medial cruciate ligament and lateral cruciate ligament and unhappy triad and meniscal tear. Okay, so now we can see here what happened. Okay, so here we discussed about McMurray test. This McMurray test is very important for detecting the medial and lateral meniscus. Okay, so here you can see this image. When externally rotate the foot and valgus test, slowly extend the knee, and we have to suspect that is medial meniscus. Okay, menisci. In lateral menisci, the internally rotate the foot and varus test and slowly extend the knee, then we have to suspect that is lateral meniscus. In positive test, while palpable or audible click, pain or locking, we can see in these things, this type of things. Okay, next one. Now each test we are going to discuss. This is very important because in practical examination they are going to ask this type of questions. So that's why this is very important. So step by step we are going to discuss. First one, anterior dry test. How we can do? You can see this image. In this image, the anterior cruciate ligament tear we can see here. So for that thing, for find out, we can do anterior dry test. The patient must be in supine position and we have to flex the knee to 90 degrees, and examiner have to pulse the tibia anteriorly while stabilizing the foot. The positive test means excessive anterior movement of tibia, then we have to suspect that is anterior collateral anterior cruciate ligament tear. Next one, posterior Dreyer test. In posterior Dreyer test, or we can tell posterior Dreyer sign, here you can see in procedure will be, you can see this image, the knee have to flex at 90 degrees and push tibia to posteriorly. In positive test, the excessive posterior movement of tibia will lead, excessive movement is there means then we have to suspect posterior cruciate ligament tear. Okay. Next one, abnormal passive abduction. In abnormal passive abduction means, here you can see MCL tear. In MCL tear you can see the abnormal passive abduction. Abnormal passive abduction. In abnormal passive abduction, you can see here like we have to apply valgus force like from lateral side at 0 degrees and 30 degrees knee flexion. In positive test, how we can know the medial space widening and medial cruciate ligament injury, we can see here. Next one, abnormal passive adduction. Abnormal passive adduction means it will comes in lateral cruciate ligament tear. Like we have to apply, you can see this image, we have to apply some force like varus force from medial side at 0 degrees to at 0 degrees and 30 degrees flexion. In positive test, the lateral space widening and the lateral cruciate ligament injury. Okay. Next one, McMurray test. In McMurray test, we can, in McMurray test it's very important test. Why? We can detect meniscus tear like medial and collateral, medial and lateral. In procedures, like we have to tell the patient to lie in supine position, and the examiner places one hand on the knee joint line to palpate for a click, and we have to hold the foot and ankle with the other hand, and we have to flexes the knee and hip. Okay. If that foot external rotation and externally rotate and the foot and the valgus stress will be positive, then slowly extend the knee, and that we have to suspect the medial meniscus. If patient like internally rotated the foot and varus stress plus slowly extend the knee, and that lateral meniscus is positive. Okay. So these are the some tests, or you can tell signs and procedures how we can do these things. Okay. Next one, when here main thing is for in knee joint anatomy, that time we discussed cruciate ligament, ACL and PCL. This ACL PCL will be inside the joints capsule across each other. So ACL runs from the anterior tibial to posterior femur. So posterior cruciate ligament runs from posterior tibial to anterior femur. The menisci will be like medial meniscus and lateral meniscus. The medial meniscus will be like C-shaped and more flexed. Why I'm telling this thing? If you know this thing properly, that C-shaped and O-shaped, you can easily find out injury in meniscus by seeing MRI. Okay. So that's why I'm telling this. That's why I'm focusing little more about these things. In menisci, medial menisci will be C-shaped and more fixed. Lateral menisci like zero-shaped, O-shaped or more mobile. The MRI of knee, we can see always we have to see like axial view. Anterior we can see patellar ligament. Posterior will be like gastrocnemius muscle. In medial we can see cruciate ligaments. Okay. You can see here, if you're seeing this top, left image, okay, here you can see here this top left image. Here you can see here already is labeled. Okay. So here you can see the medial femoral condyle and the lateral femoral condyle. You can see here this is the medial femoral condyle and lateral femoral condyle, and medial tibial condyle, lateral tibial condyle, and head of the fibula. Okay. and you can see, yeah, this is the head of the fibula, and a posterior cruciate ligament also, it's already marked by red arrow, and we can see like asterisk may indicates like intercondylar knots or joint space. The posterior cruciate ligament is visible if you are seeing this thing, okay, in the intercondylar region between femoral condyles. It appears dark and low signal intensity and continuous normal morphology. If you are seeing the right image, in this right image we can see like cross sectional axial view, the level of the knee joint. Here you can find out some structures, that is anterior cruciate ligament, posterior cruciate ligament, lateral and medial articular surfaces, and patellar ligament and lateral meniscus. And here you can see like muscles and tendons, and like sartorius muscle, okay, and gracilis tendon. You can see semitendinous, gastrocnemius, and biceps femoris tendon, okay. So this image helps to localize the cruciate ligaments within the joint capsule, like both ACL and PCL appear intact, suggesting no tear, okay. So next, if you are seeing this image, you can see here this is anterior collateral ligament. I already marked with the arrow mark. So it courses like from anterior tibia to posterior medial aspect. You can see this image like this. This thing is not, yeah, like this, okay. It courses from anterior tibial to posterior medial aspect of lateral femoral condyle. So how we can interpret it? The ACL, anterior cruciate ligament, appears as a dark continuous band, okay, and suddenly normal ACL without signs of rupture or abnormal signals, okay. Next, if you are seeing this image, second right image, you can see here it shows like posterior cruciate ligament, okay. I already marked here. It courses like from posterior tibia to lateral aspect of medial femoral condyle. How you can interpret it? The PCL, posterior cruciate ligament, appears thicker than the ACL, anterior cruciate ligament, as expected, and has a normal low signal intensity, no discontinuity, and normal PCL, okay. So what are the things we discussed today? Means we discussed about knee anatomy before discussing about knee injuries. So here main important, like we discussed like a little MRI interpretation, and here main injuries, like for your exam I'm giving some recap, quick recap. In anterior cruciate ligament, we can see like mechanism of injury will be like twisting or hyperextension. In special test we can do Ligament test and Dreyer test, okay. The key hallmarks means popping and hemarthrosis. These are the things you are getting, means we have to suspect that is anterior cruciate ligament injury. Next one, meniscus. In meniscus, the mechanism of injury will be like twisting, foot fixed, okay. Foot fixed means then after if any twisting means then the patient will get meniscus injury. The special test will be like McMurray test and the Sully test. I already saw some image, based on that I explained already. Next one, in hallmark we can see like locking and catching, okay. Next one, medial collateral ligament. In medial collateral ligament, mechanism of injury we can see valgus blow. We can say like special test will be valgus stress test, and that clue main hallmark will be medial tenderness. And next one, unhappy triad. In unhappy triad we can see mechanism of injury will be lateral blow, and the special test will be like combo of above, and the hallmark will be triple structure damage, okay. So if you found this video is helpful for you, you understood the anatomy and how that makes injury pattern easy to remember, okay. and always we have to link mechanism, structure, clinical findings and tests. Okay, I hope this video is useful for you. Still you didn't subscribe my channel, like, share and subscribe. So we will meet in our next episode, that is episode 15. Okay, in first aid series. Take care, bye bye, have a nice day.